Hi there, I'm student PTA, Mike Hawk. Today, I'm going to be getting massaged, just like they do on the Discovery Channel, by my assistant.
Hi there, I'm student PTA, Misty Mayflower. Today, I will be massaging Mike Hawk.
So what we're going to do, little therapeutic massage here on this nice bed. We have our lubricants prepared. So first and foremost, we have the warming touch. This is Mike Hawk's favorite lubricant. We also have the baby oil, lavender baby oil, and you can also go with a variety of different lotions and whatnot. Actually, whatever you want. Whatever lube's the best for you is what you can use. So Misty, today, is going to be using the warming touch on me, Mike Hawk, because I'm a little sensitive to other oils and I like it warm.
Correct. So what we're simply going to do is I'm going to start off massaging Chris's back, upper and lower, and then Chris is going to massage me and do my legs and my arms. Okay, so first things first.
Y'all ready for this?
No. First things first, we are going to start out by washing our hands thoroughly and removing all jewelry. So if you would, please follow me.
Oh, let's bring this camera too.
Yeah, don't forget that. Alright, kids. Turn on the water. Wet the hands. Remove the jewelry.
Even the wedding rings.
Engagement rings. Scrub for approximately 30 seconds. Make sure to get under those fingernails. Rinse. And dry.
Noticed how we did that for 30 seconds too.
Yes, 30 seconds. Now, back to our soothing mat.
This is where the magical massage will take place.
Chris, will you please remove your shirt for me? Thank you. Alright, now take notice that I have laid down a nice, comfortable area for Chris to relax. I'm also going to be using this towel to cover up the area that I do not want exposed to help him be comfortable
The S5 dermatome.
and relax.
That wedgie is not as relaxing as I would like. Let me
Well,
just pick
you know
that
what?
real quick. Okay.
You gotta live with it. Alright, first, since my hands are a little cold, right?
Oh yes, definitely.
I'm going to apply some of the warming touch lubrication. Ew. Oops. To my hands. A little dab goes a long way here, folks. And I'm going to warm my hands. Dude, this was gross.
This is gonna be
Vigorously.
great. Have the warming touch all over
Then
my
I'm
back.
going to start by shingling on
the warming touch.
the warming touch.
This feels amazing, Emily.
Thank you, Chris. The pros work. Once the lubricant is well lubed on the back, very warm, I'm going to start effleuraging. This is a form of slow, steady. Help me out here.
Stroking.
Stroking. Up,
Stroking is the word you're looking for. Right
across
now,
the tree branches.
Emily is stroking my
And
cock.
down into the valley. Up, across the tree branches, and down into the valley. Up.
And by the valley, she means what's not being recorded on the tape.
Oh my god, you're horrible. Once this effleurage technique has been nice and... I don't know where I'm going with this, but anyways.
She's going somewhere. Just keep spreading.
I'm spreading this, getting it nice and warm.
Oh, it's warm.
Yes, it's very warm and gooey.
I got hair in my mouth.
too much time on our hands, folks.
It's your hair.
Now, I'm going to move to the opposite side of Chris to perform some more massage techniques.
This
But
is
remember,
very lubricating.
don't ever take your hand off the patient. Okay, the next technique we're going to use is called petrissage.
This is really going to hit it deep.
So this is going to be a form of wringing, skin pinching. What else did we say?
Ringing, skin pinching, skin rolling.
I mean skin rolling.
Skin rolling.
I'm on the spot here, okay?
Ringing, you're doing fine.
So first, I'm going to start off by kneading. Is this right?
Yeah.
Does it feel good?
It feels great.
So what I'm doing here
Kind of tickles a little.
is... What am I doing here?
You're moving your hands in a rhythmic motion, back and forth.
Back and forth.
Applying slight
Back
pressure at
and
the same
forth.
time.
Grabbing the skin and kneading it. Like pizza dough.
If you want, you can do like a lift and pull technique.
Lift and pull, squeeze, and pull, squeeze, and pull. It's not supposed to tickle.
You're tickling me.
Not. Okay? Work your way in the lower back here. And then you would move to the opposite side and do it to the other side. I'm not going to show you that because it's too time consuming. But anyways, moving on to a little technique that I like to call... What's it called?
Are you going to do ringing?
Yes, ringing. Like this.
So it's kind of like you're wringing out a towel almost.
Like I'm wringing out the towel.
I can't really see your face, but it'd be easier if I could see your face.
What's that supposed to mean?
Like we could talk about what's going next.
I believe I'm doing this right, folks. I'm not
This is
really
actually
sure.
our first time massaging.
ever massaging, so... I mean, I guess you're learning from the best, technically.
That's true. The best.
We learn from the best, that's for sure.
And let me tell you what, this lubricant is just
Very
fantastic.
lubricating.
My back feels like a slip and slide right now.
It kind of looks like a slip and slide, too.
I believe it.
You're very hard. You really need this, Chris. This is really, like... Oh, so much easier doing this on Paula. Like, I feel like you're, like, tense, like you're flexing. You just
I'm
need to
not flexing
relax.
at all.
Like, listen to the music and just take yourself into, like,
If anything, I'm trying not to laugh.
a different place. Okay, now what we're doing is we're going to move on to skin rolling. You are starting at the base of the spine and working your way up the erector spinae muscles. Rolling the skin between your thumb and your forefingers. Does this feel nice, Chris?
Feels unimaginably
An effleurage
nice.
down. Any pain with this?
No pain whatsoever.
Are you lying to me?
No, I'm a little bit ticklish.
Okay.
Which could be why
Effleurage
I'm
down.
tense. Because I'm trying not to laugh because I get ticklish.
Effleurage down. Next, we're going to move on to another form.
You're doing good too.
It is called
Just keep breathing. Also, another thing you want to do is
Tappament.
move your body too. Make sure you're moving your hips.
Well, I'm moving my hips as much as I can when I'm seated.
Okay.
But anyways, we're moving on to tapperment.
I'll take her word for it.
Tappament.
Tappament.
Tappament. This is going to be a form of clapping,
Now I'm watching you.
hacking,
This is pretty good.
vibrations, or tapping. First, we're going to start off with clapping. You're going to put your hands in a cup position like this. You're going to start off up here in the upper lobes of the lungs.
We're
We're just
gonna
going to do a
hack
clapping
that
movement.
stuff up.
This is good for CF patients when they need to hack stuff up. And this lube is awfully sticky.
Yes, it is. I'm gonna borrow your
How's
towel
this?
before I leave.
How does this feel, Chris?
Feels like your hands are like flypaper sticking to my back.
I feel like I should be a little bit looser than this, but in this position it's really hard to do, and you keep flexing, and it's not making my job any better.
I'm not flexing. I'm not trying to flex.
Okay, enough with this. Now we're gonna go on to the hacking, where you put your hands in a sideward position like this, and just hack up and down the back. How's this feel, Chris?
Feels like if you're hacking the effleurage out of me right now.
I'm hacking the effleurage out of him. Alrighty. Next.
Just keep hacking. Just keep.
I'm hacking away. I'm hacking away. Next, we're just gonna go with a light little finger touch.
Ooh.
Light little finger touch.
Rather light.
We can also do something called vibrations, where you take one hand and put it on the other, and you vibrate down.
I like that the best.
Vibrate down.
Yeah,
Vibrate down.
that's pretty good.
You like that?
I do like that.
Vibrate down. My foot's stuck to this paper. Effleurage down. And now we're just going to effleurage out.
Effleurage it out.
Effleuraging it out. If you guys didn't know this, the effleurage is kind of a beginning and an ending point, just to get the muscles nice and relaxed. How's this feel, Chris?
Feels very lubed up.
Alrighty.
And very relaxing at the same time.
Now we're going to clean our patient.
I'm not sure
Since we're done
how we're going to do that.
with
But
this rag that I brought right here.
do it somehow or another.
Wash my hands off first, because it's awfully nasty.
Yes. Well, yes it is.
Clean you up. And Chris is done with his massage.
Boy, do I feel clean.
I bet. Now it's going to be your turn, Chris. You
Thank
get to
goodness.
massage my leg and my arm. Okay.
Am I clean?
Yes, you're clean.
Yes, I am. I'm very clean right now.
Alright, patient. Now you can get up and... I keep calling you Chris. You're not Chris. You're Mike. I'm sorry.
What are
I'm
you
calling my
talking about?
patient by the wrong name.
I am, in fact, Mike. And I'm going to massage you without a shirt on because
That works.
I don't feel like putting anything on right now.
Alright, Chris.
I'll just put this towel on.
What do I need to do?
You can. Lay down for me in a supine position.
What does that mean?
Means you're going to lay on your back, Emily.
Oh, okay.
And because I washed my hands in the bathroom too,
Mm-hmm.
I am just going to start. And of course we'd want to remove any bandages, which I do not have on. We're going to take our personal lubricant.
Should I scoot up a little bit?
Sure. How's that? Is that better?
Use a baby oil on me.
Yes, ma'am.
I like the smell of it better.
Yeah, I'm not a big fan of the warming touch after all.
It's pretty warm though, I have to say.
Pretty warm.
You have your back to the camera.
I don't want to be exposing myself to the camera.
Why wouldn't you? Just put your shirt back on.
Dirty.
I feel like someone's here.
I feel like you're right. Good.
Oh!
You got it open.
Welcome to Emily's personal massage.
I didn't know if I could walk in. That's why I knocked.
Say hi.
Say hi, guys.
Oh, you guys are
Hi.
making videos.
Oh, we're making videos. Do you like a massage?
You bunch of creeps.
Wait to put it on YouTube. Your hair looks cute. Thanks.
Here's our
Where's let my dogs out?
here's our bed. Oh no, battery's
You evil
low.
fucker.
Don't use those words.
That is on the floor.
What is?
That's a shadow. Just kidding.
You're ruining my video.
Good thing she didn't step on the warming touch.
Okay. Back to what we were doing.
Oh, Emily's so mean. You guys are about to have a show to New York.
What are you doing here?
I went to pick Erica up.
Oh. No!
Oh no, there's dogs in the video. so.
She don't even like you, and you're supposed to be your nieces.
Let's just pause this for a second.
I just poured this baby oil on. A positive